Hi, I'm Tom Burke, Associate Dean for Public Health Practice here at the Johns Hopkins Bloomberg School of Public Health. Welcome to Public Health on the Inside, your inside look into the world of public health. So public health, it's all about communities. It's all about understanding our communities and our populations. And in public health, we feel like, well, there's two big parts of the educational process. One is very important, and that's the theory and classroom side of things. But the actual learning may be most effective when it takes place out there in the community. So it's really my pleasure today to welcome my colleague and friend, Mindy Levin, the founder and director of our Lifeline to the community here in Baltimore, a program called SOURCE, the Student Outreach Resource Center. Mindy is a member of our faculty. She has an appointment in the Department of Health Policy and Management, as well as the Department of Community Public Health at the Johns Hopkins University School of Nursing. Mindy is really a unique faculty member in that she works with our School of Medicine, our School of Nursing, and our School of Public Health. Mindy, welcome to Public Health on the Inside. Thanks for being here.
Thanks for having me, Tom.
So it's great that we have this wonderful resource here at Hopkins, because people are probably a little bit overwhelmed when they first come here to Baltimore of just how do I connect with the community. So first off, I'd like you're the founder of SOURCE. Tell me about how things have developed, how you perceive this need, and how you reach out to our community.
Sure. So when I started here about 10 years ago, I was hired to run a small program in the School of Public Health that was really a volunteer-based program. Every year there was a different work study student that reached out to maybe a dozen community-based organizations here in East Baltimore to give our students volunteer experiences. And about that time, 10 years ago, there was funding available to hire somebody full-time to support this program with an interest of really integrating more into academics, going beyond just simple volunteerism, but saying how can our students also have an opportunity to apply the theories that they're learning in the classroom to a real-world setting out there in the Baltimore community. And so when I came on board, that's exactly what we started doing, is with little examples like working with MPH students to give them capstone projects out in the community. And when the word started getting around that we were having some early successes with students having these experiences and community organizations really having their needs fulfilled, we started having nursing students and med students showing up at the door. And pretty much what we were able to do was bring some key constituents together, some community members, some faculty from the three schools, as well as students, to say, we need to have an office that supports community engagement across these three schools that are on the same campus with basically the same organizations here in our own backyard. And in terms of the needs, I would say that we have done a number of student body surveys throughout the years that have basically been our evidence for the types of programming that we support. And what a lot of our students have said through the years is, you can obviously think that medical, nursing, and public health students have an interest in giving back to the community and volunteering, but we have rigorous academic schedules here. So what the students have really articulated is, we want to have an opportunity to have this real-world application, and they want us to see more integration into academics. And it's really how SOURCE has grown throughout the years.
But you focus on something called service learning. This is more than just volunteering.
That's right.
Explain to us what service learning is.
Service learning is much different than volunteerism because it's an extremely structured program that basically combines your typical community service with additional preparation as well as reflection. So with service learning, we focus on the fact that this is a reciprocal environment, that our students are going to learn by doing. They're going to understand the context in which they're providing the service out in the field. But we're also going to be responding to needs that have been particularly identified by our community. So we look at this as a balance between both the students learning as well as responding to community identified needs.
And you also teach a course related to this to provide academic structure and academic credit.
You've got that right. I teach one of those courses here in the school, but I also personally support about a dozen courses across the three schools where we are focusing on the preparation that students need to go through before they go out into the community, giving them the skills they need, and then we do a lot of reflection to get the students to understand that link between what is happening out in the community and how this is going to have an impact on their academics and their roles of professionals down the future.
So you mentioned getting students ready. We have students from all over the world and all over the country. And I moved to Baltimore a while back and realized, wow, Baltimore is a unique place with some unique challenges. Give us some examples of how you get people ready to face the community of Baltimore and be part of the community.
So there's a lot that we do to get people ready to work in Baltimore. One of them is getting students to understand the history of Baltimore, as well as the unique history between Johns Hopkins and the East Baltimore community.
Sometimes challenging.
Very challenging. It can be viewed as a love-hate relationship. There are things that have been wonderful throughout the years and also things that we've learned from and need to improve upon moving forward. So oftentimes, a lot of our faculty members, we bring in different guest speakers, different community representatives to have their voices heard. And it's very important that we retell the history so people understand why there are people in the community that have these different reactions when they have students from Hopkins coming forward to say, I want to work with you and your community organizations. And one of the exciting new things that we have available this academic year is that we now have a small series of online modules to basically help prepare students to work out in the community. And we talk about the history. We also talk about kind of the competencies for academic community partnerships. We give different examples of how students can work with the community, as well as we talk about some of the values-based approaches and how we should ethically and responsibly be working with our community as key partners in the process.
And we in public health know understanding the cultures that we work in is really important, and I think you provide a tremendous resource for the entire university. And you work with faculty, too, to help them.
That's right. One of the unique things that we have through SOURCE is that we have what we call our SOURCE Service Learning Faculty Fellows Program. And this is basically a program where we have a cohort of faculty members from across the 3 schools, and we teach them about service learning pedagogy. We help them understand the preparation process, as well as really focusing on reflection and how we're going to assess reflection, because this is something that is still very curricular based and there is academic rigor to the work that they're doing. And these cohorts of faculty members, they basically start with a 2.5-day retreat, and then we have monthly meetings as a cohort throughout the year, as well as having individual SOURCE staff members that provide one-on-one guidance and advising to faculty members and helping them to develop their service learning courses or to integrate a service learning component into an existing course.
I think that's terrific. It's one of the ways we here at Hopkins are trying to break down the walls between academia and our communities. So give us some examples. I've talked to many students through the years who've had incredible experiences that actually changed their perception of not only Baltimore, but changed the direction of their careers. You work with a lot of cool little organizations. What are some of the cool opportunities that students have?
Great. Because we focus on not only the service learning courses, we also have kind of the co-curricular experiences, and we partner with about 100 different nonprofits. I can tell you through the years I have countless really cool examples of things that people are doing. I can start with some of the things that students are even doing this year.
Great.
The Baltimore Community Practicum course is a course that I teach here in the school. And basically, our community partners submit project ideas at the beginning of the year. And then we're able to recruit students to work on those specific projects. So one of our MPH students, Yvonne Kingen, she is working with Baltimore City Health Department and their Ryan White program. And she's using her skills from her past career in developing a new HIV multimedia education program. So basically trying to get some information out there in modules that are going to go out to community as well as to different providers focused on HIV education. And they're really excited about that opportunity, and she's heavily working on that right now. We also have other courses. For example, Ronnie Neff teaches the Baltimore Food Systems course. And in this course, she's giving students the opportunity to understand food needs, food deserts, food policy development by getting them involved with organizations that are doing this work at the front lines. So last year we had a group of students that were here working with Johns Hopkins Hospital and working at the WIC program. And the students really walked away with working directly with clients and getting them to basically apply for food supplement program needs. And their numbers went up dramatically at WIC because they had this small cohort of students working with them. But the evaluations that the students shared with us, kind of the qualitative information, has been that they had no idea about the barriers and the needs, and they would never have had that type of experience had they not been working directly with the clients in this particular setting.
So they're addressing true public health needs of our community.
You got it. You got it.
That's great. Now, many students may think, well, Baltimore's a little bit scary, and there is that HBO series out there that we don't talk about too much, but you've had a tremendous record of providing really rewarding experiences to folks and actually making sure that they develop not only street smarts, but a tremendous sense of how to keep yourself safe in the urban community.
Mm-hmm. That's right. So I'll agree that we have a lot of new students as well as new faculty and staff that come to Baltimore. They think about the wire and they get scared. Now, I'm born and raised here in Baltimore, so it's my hometown. I have a little bit of extra love for the city. And what we really encourage people to do is give Baltimore a shot and go out there. And what people have found is if they give themselves the opportunity to explore the city, they fall in love with the different neighborhoods, the charismatic attitude of the folks here. They understand how resilient community members can be here in Baltimore. And so as we have more and more students and faculty that are deciding to go outside of the boundaries of Johns Hopkins, they're getting to understand that Baltimore has that small town feel. People are connected. When you go into one of our local nonprofits, oftentimes they don't extend their hand, but they greet you with a hug. And it's very warm and welcoming. When you see people on the streets, we say hello. And, I've got students that come here from New York where they say, you never say hello to a stranger on the street. You just keep on walking, right?
Same thing in Jersey.
There you go. Got to throw in your jersey, right, Tom?
Right.
So what we basically say is that once students go out and they learn that people are really welcoming and excited to have folks work with their organizations.
Lindy, thank you for all that you do, your enthusiasm. It's terrific to see the enthusiasm of our students when they connect with the Baltimore community, and you've been such a big part of that for this university. And thank you all for listening today to Public Health on the Inside.